Physiotherapy is a type of healthcare profession which focuses on establishing the mobility and strengthening of the affected body parts. It is most commonly prescribed treatment to assist in the recovery of body parts from injury and other conditions. Hi, I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospitals. So on the occasion of World Physiotherapy Day that is observed on 8th of September, we are here to generate awareness that crucial contributions physiotherapists make to our society. Joining our discussion today is Dr. G. N. Sumanth, Chief Physiotherapist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Hi, ma'am.
So physiotherapy plays a significant role, especially in recovery of most of medical conditions. So to begin with, what exactly is physiotherapy?
So the physiotherapy is it's a physical therapy. Here we'll be treating the patients in three things. We work on diagnostic, preventive and curative. We work on pain management as well as improving the strength and balance. And we bring back to the patient to the near optimal levels. That will be the physiotherapy goal. So here we'll be managing the patients in two things. We work on two things mainly. So we'll be having some physical agents and physical exercises. In physical agents, we have got different pain management modalities. We'll be using those in controlling the pain. And we have got a different form of exercises. And again, these exercises, depending upon your orthopedic, sports, neurological and cardiopulmonary conditions, based on those things, we'll be selecting the exercises and we'll be prescribing in getting an improvement for the patient.
So discussing about arthritis in particular, Sumanth, what is the role of physiotherapy in managing arthritis?
So there are different types of arthritis. Among all, most popular we know is an osteoarthritis and rheumatoid arthritis. And next is ankylosing spondylosis. In osteoarthritis and rheumatoid arthritis, mostly the joints will be affected. In osteoarthritis, only one particular joint will be affected and max two joints will be affected. Whereas in rheumatoid arthritis, the multiple joints will be affected. So here the patient concerns will be the pain. So first they come to us for controlling the pain. The exercise is medicine. Here the patient tends to do the exercise for the long time. And the exercise prescription in osteoarthritis and rheumatoid arthritis, it will be completely different. As I said, here it is a one joint involvement, here multiple joints involvement. So here we should not work only on strength management, and we need to work a lot on endurance management and other functional capacities.
So Sumanth, we've been discussing about osteoarthritis and rheumatoid arthritis and how these two conditions affect differently. So can you briefly explain how these two conditions, that is osteoarthritis and rheumatoid arthritis, are managed differently?
These two are completely two different poles. The first and foremost, for a physiotherapist, it's very important to create an interest and adherence towards the exercises. So after doing a proper assessment, it's very important to give a custom-made protocol to the patient. So here, when we see our day-to-day life, so not only the people with osteoarthritis or rheumatoid arthritis, normal people also, you check your day from morning to evening. Here, what happens is we will be doing a lot of endurance activity rather than a strengthening activity. So suddenly, the people who is coming to us with an OA knee or rheumatoid arthritis, we should not jump and give them to a strengthening activity. So we should decide a protocol which is good for an endurance. So once the endurance is sets in, slowly we need to come up with an strengthening exercises. In strengthening exercises also, dosimetry is very important and it is the key. The dosimetry of exercises, it will be decided by the patient itself. Next, when it comes to the exercise, so the amount of exercises which we give in osteoarthritis and in rheumatoid arthritis is completely different. Here, the functional capacity of a patient with rheumatoid arthritis will be very less. And here, it will be a bit better in osteoarthritis. In exercise is not only the strength, exercise is a flexibility exercises, is a strengthening exercises, and it is an endurance exercises, and it is a balance exercises. All four is the key exercises in prescribing the patient, and it differs from OA and RN.
So muscle strengthening or resistant training is equally important for joint longevity as well. So what are the different techniques you implement for this, doctor?
It's a very good question, ma'am. So here, as I'm telling you from beginning, it's a dosimetry. So the question is different techniques of resisted exercises. So these resisted exercises, we have got different things. We have got an isometric exercises, isotonic exercises, eccentric exercises. For example, if you take isometric exercises, suppose in osteoarthritis or rheumatoid arthritis, the patient will be having a painful joints and it is very difficult for them to move the joint. So to move the joint, initially, we need to give an isometric exercises. Isometric exercises is the key. Okay, it has got like an analgesic effects. Isometric health exercises, it helps in controlling the pain. And after that, gradually we need to progress to multiple ranges. You need to move the joint at multiple ranges. You need to give an isometric exercises. Once the joint range of motions will be increased, the slowly you can progress to isotonic exercises. Isotonic exercise is nothing but offering some resistance and moving your joint throughout the range. So next is eccentric loads. Eccentric loads are very good for tendons.
So most of us train at the gym for muscle strengthening. So could you explain how does this technique differ from a physiotherapist training?
Our curriculum says when the person comes with a problem with us at one particular joint, suppose if anyone is having a 50 years old guy is having an osteoarthritis as a stage 3, when it comes to me, so being a physiotherapist, what I look at is, I look at his joint above the knee and joint below the knee. Then only I come to the conclusion what type of protocol I should design for knee. And while he is doing the exercises, I'll see whether he is doing an exercise at a compressive zone. So we being a physiotherapist, will plan a treatment protocols. Okay, they should work on where there is no much load on a joint, so that there will be no much damage to the joint. So, and other thing is, and we take care of the core. If the core strength is good, there will be a less load on the knee. So we see, though you are coming to me for a knee pain, I see you as a holistic approach. I take care of each and every part and will be seeing. So, and moreover, we respect, as I said you before, we will be respecting the patient pain, we will be respecting the patient range, and we'll be respecting the patient comfortable zone. Based on 3 things, we'll be giving an exercise program.
So fatigue. Fatigue is one of the most common complaints we see in different chronic conditions. So what are some of the energy conserving techniques that you implement, especially dealing with arthritis patient?
The energy conservation techniques is the big thing coming from past 5 years. These energy conservation techniques, we need to really take care in case of rheumatoid arthritis cases. So here, once, as I said you before, while doing exercises, once the fatigue sets in, you will be activating the unnecessary muscle groups. Unnecessary muscle group or proprioception will be inhibited. And here, energy conservation techniques means the simple things I can say. In rheumatoid arthritis, most of the time, the small joints or wrist joints will be affected more. So if you want to take a cup of coffee, so what we'll be using, we will be holding your cup tightly and we'll be using our wrist while taking a coffee. So you'll be creating a more stress on your joints. Instead of that, you take a bigger cup, hold widely. So while you want to drink a coffee, so use more of your bigger joints and elbow joints, so that there'll be a less load on your small joints. So here, this is the one sort of energy conservation techniques. And other thing, if you are working at any office, you need to predefine your work area. You'll be using certain things a lot. So those things you should keep at a proper height, and unnecessarily you should not bend, and you should not pick up. You should arrange your area nicely. And then next thing, if you want to lift some things, if it is a daily routine practice, keep those things at an upper height. And instead of lifting and taking up, you try to make it use of pushing or pull.
I think that's very useful technique and very well explained. So what is the role of assistive devices or braces in physiotherapy, doctor?
assistive devices and braces. Assistive devices means when there is an active inflammation in your joint. So especially in rheumatoid arthritis cases, so it comes at a very young age. So we'll be giving certain crutches. So crutches helps in offloading your joints. Pain provoking will be reduced. If pain provoking is reduced, the muscle spasms will be reduced. So it is very, very helpful uses of assistive devices if there is an active inflammation. The same thing with your osteoarthritis. And braces is a very good question. Especially in rheumatoid arthritis, while you are using a brace, okay, you should be very careful. You should monitor the areas, because in rheumatoid arthritis there will be an inflammation. The joint swellings will be there. The skin will be very sensitive. There is a chance of aberrations that can cause some other complications. So you should check. You should check every day after using the brace whether your skin is there any cut or not. So when it comes to your osteoarthritis, I recommend using a braces when you have got a severe pain. So once your physiotherapy and medical management sets in, slowly the pain starts controlling. So then gradually you need to remove your braces. So continuous uses of your braces, what happens, it inhibits your muscles. So means your muscle function won't be there. So I recommend only the brace for a short period of time. So once you work out on a muscle, keep your muscle active in your optimal limits.
So now it's time to bust few myths and know the fact. Taking the first one, people with arthritis should not exercise.
No, you should exercise, and dosimetry, as I said to you earlier, dosimetry is the key. So whether you are exercising 5 minutes or half an hour, there is no standard time that you should exercise for half an hour or 1 hour. Start with 5 minutes within your limits. Once you get a good adherence with exercises, okay, start working within your limits, and exercise should be endurance and strengthening, both. You should exercise.
Taking the next one, heat is better than ice therapy for arthritis.
Yeah, so it is a very good question, and most of the time, most of the patients will ask us whether I should keep a hot pack or cold pack when I get a pain. Okay, so the simple thing is joint inflammation means joint will be, in case of rheumatoid arthritis, your joints will be swollen and it will be hot. On hot, if you keep one more hot, you will be increasing the inflammation. So see, if something is hot, you should keep something cold therapy. So in case of rheumatoid arthritis, I usually recommend, if there is active inflammation, I recommend only cold therapies. So when it is an osteoarthritis, if there is any synovial involvement, if there is any swelling, and again I recommend ice therapy. So if there is no swelling, only the patient has got the pain, okay, we can go for hot therapy.
Is prolonged rest good or bad for joint pain, doctor?
Prolonged rest is not at all good. Okay, it makes your muscle atrophy. Okay, it makes your joint stiff. So first start active. So the theme of this World Physical Therapy Day is keep moving your joint within your optimal limits. No complete rest, prolonged rest, no, we don't recommend.
After surgery, physiotherapy has minimal role for strengthening of joints.
No, after surgery, the physiotherapy has got a major role for joint strengthening, because you need to really exercise for few months. You need to take under supervision. You need to do exercise for few days to few months. After that, you need to continue the exercises throughout your life.
And taking the last one, does joint cracking help to relieve arthritic pain?
Nowadays, we are getting many inquiries to us. The people with ankylosing spondylosis that is affected, that typically affects your spine and the sacroiliac joints, and they call us and they come to us and they ask us to crack their joint. So definitely one should be very, very careful before giving your spine for cracking. So here what happens, your bone mineral density of your joints will be very less. Your joint will be most osteoporotic. So when we are doing a cracking, there is a chance of breaking of your spine. So you should be very careful. Okay, in these cases, when it comes to rheumatology, you should respect your pain. You should respect overall functioning of your body. You should respect your muscle status. You should respect your bone condition. And you should start with an optimal exercises, no high intensity exercises, no high crackings.
So Sumanth, I'm sure you've been a part of many successful stories. So can you share some stories where physiotherapy has made a significant impact on patients' quality of life?
Recently, I had a patient from Kamaradi. He is 60 years old. He has come to me with his main complaint was back pain. He has got some gastric issues, and he has been for back pain. He has been to orthopedicians and spine physicians. Okay, they have checked. They are ruled up. They have taken this MRI and everything. Everything is absolutely fine. And means he has got slight GR problem. For that, his ultrasound abdomen is clear. They have taken. So when he came to me, he said he has got a back pain. So when I took his history, he's a 60 years old guy, and he's been a very active farmer. And when I checked his core muscle strength, the strength was very good. And I checked the completely core. It was properly each and every muscle is properly activating. In spite of that, the patient is complaining the back pain. I asked him specifically when he will get a back pain. The patient said when he's passing stools, he'll get a pain exactly at between L2 and L3 area. Then that made me to think, why can't I go and assess his abdominal area? So we are trained in visceral manual therapy. When I started palpating his abdomen, and when we are doing that, so when I'm checking his lower quadrant, when I'm palpating here, he's complaining. When I'm doing this pressing here, he's complaining of pain in the back. So then we have got, in our assessment, we have got a thing like Chapman points. Chapman points are the painful points. Usually these points will develop over the tendon area or over the bony areas. So he is complaining exactly over the L1 and L2 area. So that made me to work out on is the right iliosacral wall. So iliosacral wall, and his complaints are very, very typical. When he's passing the stool first time, he can pass the stool, and immediately after 10-15 minutes he feels like he wants to pass the stool again. So he started, when he wants to feel he wants to pass the stool again, what he does is he keeps one hand over here and he presses. When he presses, he'd get a feeling of passing a stool. So then I started working over this area. I did some visceral manual therapy, manual therapy, and slowly after 4 or 5 sessions, the patient said what complaint is facing before, it has come down. So what we feel is the visceral manual therapy, we should not. It's a missing link. It's a missing link. Though in spite of having a good MRI and CT scan, we should feel something with a hand at which we are being trained, and we need to check for Chapman points, for referred points, and we need to work out on that area. So it's a very interesting case I have seen in my 20 years of experience.
So that's how diagnostic and curative physiotherapy works, right?
Yeah.
So before we end this episode, we'd like to know what your fitness mantra is, and is there any message that you would like to share with our audience out there?
Fitness mantra is 80% diet and 20% exercise. Okay, in that exercise also really we don't work really hard hitting gym and all. So we do a lot of we calculate 5,000 steps a day. We work on 5,000 steps a day, and 20 minutes to 30 minutes we really work out. I really work out on doing some endurance program, and we're strengthening twice a week. So the physiotherapy, we are not only in orthopedics, we are into neurological, we are into cardiopulmonary, we are into gynecology, we are into balance issues like vertigo, we are into geriatric issues, and we are into the pediatric issues. So right from your birth to your old age, we have got our own role. So just take advantage of us, come to us. We'll be doing your screening, we'll be doing your assessment, we'll be helping you in prescribing exercise protocol. And we, as I said you earlier, we are into diagnostic, we are into preventive, we are into curative. We function in these 3 areas, and we help you, we try to give you good health.
So thank you, Dr. Sumanth. It was wonderful having you here on our episode today.
Thank you.
So this brings us to the end of this episode. Hope you've enjoyed watching this, and don't forget to join us for the next week as well. Until then, take care and stay fit. Thank you.